Oh, so you
Sharon.
down towards the bottom, one more. Right.
There. There we do it. Yeah.
All right, good morning, everybody. Thank you all so much for being here today on a beautiful day. We haven't had a lot of nice weekends lately, so I appreciate all of your engagement and being here. I'm Mayor Ted Kozlowski, and I just wanted to welcome you all. I also want to take this moment to thank Congresswoman McCollum for being such a great resource for our area and our valley. The city of Stillwater has been faced with some pretty big challenges where we need the help of our federal elected officials. And I just want to assure you and be thankful for how much of an advocate she is for us, and especially in dealing with things like PFAS that we just found in our water. She's been absolutely incredible during her staff in helping the city of Stillwater navigate some of these things. With that, I'm going to turn it over to my fellow class of 95 graduate, and also our representative, Josiah Hill, who's going to lead us in the Pledge of Allegiance. So thank you all for being here.
Thank you, Ted, and welcome. With your not welcome to our city. And I wanted to offer as a quick introduction. My name is Josiah Hill. Representing you ever have a need or a question, or Ted and I are more than open to connect, so please reach out. With that, I want to lead us in the Pledge of Allegiance to get things underway. So if you would join me, if you are able to stand. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Congresswoman McCollum.
What a beautiful day. And it's not a surprise that the 400 RSVP folks we had decided to take advantage of the opportunity to watch this live stream. I want to thank again the mayor for being here, as well as Representative Hill. And we are joined by another state representative, dear friend, a person who goes back before either one of us were ever elected to office, and Representative Peter Fisher. Peter, thank you for being here today. Maybe we hope to be going back into session, maybe soon. And I have been attending town halls like the state of Minnesota, House of Representatives. CBC, there are benefits to the Department of Transportation, there's benefits to human services, there's benefits to our schools. And I don't even have the full list of the cuts that Elon Musk and Bush did. I'm on the Appropriations Committee, and we don't have any idea of what the president is planning on releasing and spending and not putting forward to the states, to our cities, to our counties, to our VA, other places like that. So we've been demanding letters, we've been taking is taking what we've been waiting for it, and that we will prevail. But democracy is don't happen like that. So it happens in dictatorships, and that's what we're trying to prevent. So we work as a team here in the 4th Congressional District, whether it's state, local, school boards, everyone included, because we all work with you. So it's a Mary passed away on Monday after a courageous battle with breast cancer. A chance to leave her a voicemail. Our office was assisting her with some of her last wishes. She led a life of service, and I'm grateful that I worked for her. And I'm grateful that I worked for her because she saw the importance of coming together. When I first met Mary, we had different opinions on the Stillwater Bridge. Not that it didn't need to be replaced. We needed a new Stillwater Bridge, but we were discussing the size and the scope of that bridge. And we always had a respectful, thoughtful conversation. And her side, I was on the listening side, but we became fast brothers, working together with the citizens of Oak Park Heights together on that. So again, thank you for joining us in this town hall. It's going to focus primarily on Medicaid management for Minnesota families. And those who are joining us via live stream, welcome. And I want to take a moment to thank our interpreters here, Nick and Megan. For those of you who don't know, I'm from a family with a lot of business. I'm probably a member of the college, appointed by Jeffrey, the speaker, soon to be, I hope, Speaker Jeffries. And that is the college that I have family graduated from, which was speaker party hearing in death. So I'm used to sign language interpreters at weddings and funerals and just part of my everyday life. So let's give them a round of applause. Yeah. I want to recognize Governor Walsh, not with the school. I'm just gonna take a few things from it because I think this sums up our state. Oh, we have another state legislator. Hello, from St. Paul. I'm a representative for, so thank you for being here. So this is the governor's letter. This is from the governor. Estimates I've seen suggest that any service includes more than $500 million of growth every year for this Republican budget bill. As many as 250,000 would be eliminated, and providers like that would be funds for services that to do the portion. That means health checks, breast screenings, and all those other kinds of things that are provided. Counties and tribal governments will be required to spend millions of dollars on administrative costs to comply with all the purposes of families. And then I'll close with the governor said in this paragraph. This is what the Republican budget bill passed by the House. The state cannot backfill this loss of coverage funds. But the Senate has not, the U.S. Senate has not yet started debating this legislation. So the fight is not over. I am grateful to everyone who is giving their time and their voice to this cause, and I'm grateful as always for the opportunity to work with you all to make Minnesota a great place to live and raise a family. And that's from Governor Walsh. So I'm always, as a teacher, nervous to hand over because you're looking at and listening to our speakers. So I'm going to get to the heart of the matter. Before we hear from our panel, which is Children's Specialty Hospital, which has played a very special role in Minnesota's history. Brand more registered nurse to member of the Minnesota Nurses Association. Smooth. His last name is one village in southern India, and his guest. I wasn't even close, was I? Okay, the two of you can get me later. Anyways, the very important role that Smith plays on the Governor Council of Developmental Disabilities. We are very honored to have him here with us today. Assistant Commissioner and Jessica Francis, who is as well here right from Oakdale. She's the Executive Director of Open Coverage, which is I'm going to give you a brief update about what happened in the morning. The Republicans convened the House Rules Committee and worked nonstop to rush through Mr. Trump's One Big Beautiful Bill Act. And yes, that is the real name of the bill. So I have to officially call that. Then, a day later, 5:30 Thursday morning, the sun was even up yet in Washington, D.C. The House Republicans passed the bill by a vote of 215 to 214, with 2 Republicans who somehow managed to miss the vote. I was there, and with all the Democrats, we voted no. Now, from my colleagues on the other side of the aisle, they say their bill will not affect the most vulnerable who rely on services in the bill. In fact, they held it up and they would say, show me where the cuts are happening immediately. Well, they're not being honest. They play games to get critical votes from their own members to make it to their self-imposed deadline. But even then, they could only eke out a 1-vote win. The ugly truth of the big beautiful bill is even with all their game playing, they are cutting critical services that Americans rely on. This bill has explosive impacts of the tax cuts to our federal debt. The ugly truth is that they're timing the most drastic cuts to healthcare for vulnerable Minnesotans and people all over this country to take place immediately after the next election in 2026. If it's in the bill, it doesn't take effect until 2026. The ugly truth of the big beautiful bill is it makes the largest cuts to healthcare in the history of our country. Nearly $1 trillion cut from Medicaid and cut from the Affordable Care Act. And that doesn't even include the cuts that I was talking about earlier. We don't know the impacts to the federal government or the state for the CDC, the NIH, University Cancer Research grants, cuts to the DOD, and the Veterans Research Healthcare grants, all cut, but they haven't shown us the impact of those cuts yet. But back to this bill, it cuts nearly 4 million Americans from reliable health insurance. 20,000 Minnesotans with disabilities, seniors, children, and working parents right here in the 4th Congressional District will have their health care stripped away, and that's the equivalent to every single resident in Stillwater losing their health care like that. The bill just doesn't kick people off their health insurance. It creates more hurdles for people to be covered. In fact, there are 30 separate provisions to raise premiums, impose limits on who is eligible, add billions of working Americans with unnecessary obstacles to attain health coverage. And another ugly truth is this bill cuts $30 billion from the Supplemental Nutrition Program called SNAP. That's 45,000 Minnesotans who will go hungry without SNAP assistance that they rely on. That's like every resident, including all the children in Maplewood, going to bed with insufficient nutrition, going to bed hungry and waking up hungry every day. Republicans are making these cuts to services to make giant, permanent tax breaks to billionaires like Elon Musk and companies who currently don't pay their fair share of taxes. In fact, some large corporations pay zero in taxes. A millionaire would receive at least $90,000 in permanent tax breaks. An average family in this district earning less than $50,000 a year would get $300 in tax cuts in 2027. That's less than $1 a day. In short, the ugly truth about the big, beautiful bill is another GOP tax scheme. Despite the deep cuts to Medicaid, SNAP, and other services Minnesotans rely on, Republicans are being dishonest about the numbers. They simply don't add up. The ugly truth is the big, beautiful bill adds $5 trillion in debt when the tax cuts are made permanent. That's on top of the $2 trillion debt burden we are already facing that was added by the Trump 2017 tax bill. The more we learn about this bill, the more there is to dislike. So when people are talking about a balanced budget and how we have to cut services to manage our debt, well, take a look at that chart. It is the tax bill that is adding to the debt. So they passed a bill while most of America was sleeping. I stayed up for almost 2 days and watched this unfold. This tax scam is a lose-lose for the middle class. I want to thank all of you. Since January, my office has been flooded with phone calls, emails, handwritten letters, in-person visits to oppose the Republican efforts to cut Medicaid and SNAP. Now, I want you to know I will continue to stop any effort I can to cut Medicaid, Medicare, Medicare is also in this big view with potential cuts. Social Security, veteran benefits, and nutrition assistance for families. Especially when they're just being done to honestly say they're balancing the budget so that they can give tax breaks to millionaires and billionaires. I'm going to continue to lead with my Minnesota values and represent the voice of my community. And I will always vote to stand up for you and the needs of your family. Now, I want to put a little more flesh on this and know that I'm talking to people who are working for you all the time. People who are going to be experiencing these cuts firsthand. Heard from the governor, we've been joined by another legislator, and we will start off letting you know how there are all these for these looming cuts that are coming, and we don't still know what else could be in the future with the Congress not standing up to the president to release funds that have been fully legally given to many of these organizations and fully legally stated in the Constitution that the power of the purse relies with you, the people, in the people's house. So, Deputy Commissioner.
Thank you, Congresswoman. Thanks everybody for being here today. I'm John Connolly, Deputy Commissioner and State Medicaid Director at the Minnesota Department of Human Services. Thanks for your commitment to the health of our community. I've been traveling across Minnesota talking with community members, healthcare providers, health professionals, policymakers, and community members about the impact of Medicaid, what we call medical assistance here in Minnesota. And while those conversations often begin with policy or budget numbers, they always come back to the same thing: people. Because this program supports more than 1 million Minnesotans, about 1.2 million in total. It's a lifeline for our state, for newborns, for seniors, for people with disabilities, and for working families just trying to stay afloat. So we're here today because that lifeline is under threat, as the Congresswoman told us. Congress is proposing deep cuts to Medicaid, nearly $1 trillion, cuts that would cause serious harm right here in Minnesota. Let me be clear, emphasizing the Congresswoman made clear. The bill on the table is inefficient, ineffective, and fundamentally unfair. It achieves so-called savings by slashing federal Medicaid funding, raising costs for states, counties, tribal nations, healthcare providers, and people themselves, making it harder for people to stay covered through complex paperwork and administrative hurdles. The goal of all this? Disenrollment. Disenrollment, pushing people off of their health coverage regardless of the fact that they are likely eligible for it. If passed, the bill would bury already overworked staff in counties and tribal nations and vulnerable families in red tape. It would strip coverage from potentially hundreds of thousands of Minnesotans. It would also cost our state roughly $500 million a year in lost federal funding, plus billions more in ripple effects to counties, hospitals, and local healthcare providers. So, what's the result of all of this? People end up skipping regular preventive care. Health outcomes worsen. Costs rise for everyone, not just the people who lose coverage. So let me tell you a bit about the human impact of this and about the members of our programs. I'll start with Christine and her family. Christine was a single mom raising 4 kids. While going back to school to earn a degree, her family relied on medical assistance or Medicaid to stay healthy. And that support was a turning point for her and her children. It allowed her to finish school, get a job, and ultimately earn her way off all public assistance. Today, her children are adults. 2 of them live with severe and persistent mental illness. Although they have Medicaid and private insurance through Christine's job, it's medical assistance that fills the gaps and makes critical services possible because other sources of coverage don't cover those services. Her son gets weekly visits from a nurse who checks on him and sets up his medications. Her daughter developed agoraphobia, At one point, she couldn't even get out of the car on trips to the grocery store. Sometimes she couldn't even sit in the car while Christine ran inside. But thanks to ARMS, a benefit in medical assistance known as Adult Rehabilitative Mental Health Services, her daughter slowly began to re-engage. Over time, she was able to leave the house, do her own shopping, and eventually earn her college degree at MSU Medicaid. Without medical assistance, Christine says she would have had no choice but to quit her job to care for her children. Instead, medical assistance provided the care that they needed and gave Christine this ability to keep working and contributing to her community. So in Christine's words, medical assistance didn't just save our lives. It gave us a choice to move forward. It gave me the ability to keep working, to provide private insurance and to stay afloat. And Christine reminds us, when it comes to mental illness, especially the kind you can't always see, it's not just about the quality of care. It's about quality of life, and sometimes it's about life and death. So, if these cuts go forward, families like Christine's will face impossible choices between caregiving and working, between food and medicine. Our hospitals, especially those in rural communities, will suffer, and Minnesotans will fall from grace. That is almost assured. Medicaid is more than a line item. It's a foundation for health, stability, and opportunity. And it's our job to protect it for children, seniors, people with disabilities, and working families across the state. So thank you again for being here. Thank you to the Congresswoman for bringing us together. Thank you for adding your voice, and thank you for working together to keep Minnesota strong and healthy.
Good morning. My name is Barbara Shores. I'm the current president and CEO of Children's Specialty Healthcare, which has been in District 4 since 1897. We're headquartered at our hospital in 2015. We also have 10 clinics that are spread out across the Minnesota. I'm grateful for Representative McCollum and my colleagues on the stage for us to try and knit together how important Medicaid is to all of us, whether we directly receive services ourselves or individuals in our neighborhoods do. Medicaid is absolutely an indispensable resource for individuals that are served by trends. Most know that Medicaid is for an income-based eligibility, but most don't always know that disability or medical condition, by no fault of their own, the child can qualify for Medicaid. When we have these disabilities stemming from complex medical conditions and rare disease, we need to have coverage for those living amongst us in our community for where commercial insurance won't cover even if they're paid and or the families cannot provide for their own. With that, Medicaid, also known as medical assistance, is in partnership with several programs across the state. And it's foundational to the health and well-being of the whole person versus just clinical care. Gillette Children, 65% of our patients qualify for Medicaid services based on their condition and or disability. Cuts to Medicaid would be absolutely catastrophic, not just to them, but to their families and those who care for them. When discussions turn to Medicaid costs, as John mentioned, some only see it as a number, and they're throwing out large numbers to create fear. But in these numbers are people, and within people, we have our children. There are families navigating uncertainty of diagnosis, the anxieties that their children and their siblings face, and people with disabilities depend on regular therapies, specialized equipment, and continuous care and pharmaceuticals to ensure that they can live their best life. Cuts to Medicaid just don't string the system in Washington that put lives in our community at risk. Many of us in this room are very well aware that Medicaid is also a federal and state level budget, but I want to emphasize the impact at the counties and local level. The services rendered through the Medicaid program are often distributed at the county level through something called waiver services. They're given through our hospital systems, our clinics, our schools, and several of the programs you'll hear from today. Without these services, we can't treat the whole person. We know for healthcare, it's not just a trip to a hospital. That's not the end game. That's not our goal. The goal is to make people independent and to live their story and to live their goals the way that they intend to. So with that, when we talk about disability, we talk about Gillette, and we talk about the cuts to Medicaid, I want to share with you a story about Ashley. I think we have a photo, could not join us today. She's been a patient with us at Gillette since she's been 3 years old. She sees several of our specialists, and our goal is for her family and her to set what she wants to get out of life. And then we put together the clinical plan and the support services to help her get there. Ashley was born with Rett syndrome, which is a rare neurological condition that can result in a slow growth, loss of movement, coordination challenges, a loss of ability to communicate, breathing problems, seizures, oftentimes intellectual disability, among other symptoms. Ashley qualifies for Medicaid due to her disability. Her dad, Jason, is a police officer who has significantly robust commercial insurance through his employer. However, the commercial insurers rarely cover the full range of services and equipment needed for children who have these complex or rare conditions. Medicaid does, through the federal, the state, and the county level. This includes assistive communication devices, durable medical equipment, and in-home care. In Ashlyn's case, she requires 24/7 care. It is not optional. For her not to be in a residential setting, to be cared for at home with those she can trust and those who love her, she needs Medicaid. The consequences of not having it could be deadly for her and catastrophic to her family. So I'd like to read a note from her father, Jason. He shares, without Medicaid, we would not be able to hire the staff that we need to make sure Ashley is taken care of 24 hours a day. If that gets cut, it essentially means she would not have the care that she needs to stay healthy, and my wife and I would need to quit our jobs to become full-time caregivers. Medicaid and its program allows us to live a more fulfilling life as employees of the public sector who can give back to our community. I can't emphasize enough that cuts to Medicaid are cuts to people, to their dignity, to their health, and to their future. I want to thank all of you for your interest in this matter and for continuing to stay engaged. Thank you.
One thing that I'm inviting you today. Thank you. Thank everyone for being here and for tuning in at home, and for your participation in this important effort and being aware of it. It's incredibly important. That's right. As a nurse with experience at long-term care facilities in both urban and suburban hospitals, I see firsthand how critical federal programs like Medicare and Medicaid are for our seniors and people with different abilities. These programs are often the only way vulnerable populations can access essential care. Nursing homes support our elderly in the most vulnerable years, but these facilities are already stretched thin, even before considering any proposed Medicaid cuts. If funding is reduced, many will be turning away Medicaid-dependent residents because reimbursement rates won't cover this care. These are people who have contributed to society their entire lives. Abandoning them in their time of need would be a failure of our moral obligation. These cuts will also impact staffing. It's very common for a single nurse to care for about 25 patients per shift in long-term care facilities. With fewer resources, these ratios will grow even more dangerous, putting both patients and caregivers at risk. The system is already fragile. These cuts would push it past the breaking point. In the hospital, I care for patients who rely entirely on federally funded services. One of them, Molly, has cerebral palsy and epilepsy. She receives nutrition through a feeding tube and depends on specialized equipment and in-home support for basic needs, mobility, hygiene, and communication. Her quality of life and ability to engage with the world are made possible by these programs. Without them, Molly's health and independence would deteriorate rapidly. I also see patients with chronic conditions like heart failure and kidney disease. They can't afford routine care, they skip medications and checkups. They wait until their symptoms are so severe, they require hospitalization. But then it's often too late for preventative measures. Recovery becomes longer, more painful, and far more expensive, not just for them, but for the system. Patients don't disappear if money is cut. They just come in sicker, stay longer, and cost more to treat. Hospitals carry these costs, or taxpayers will. It's not just a human cost, it's also a financial one. After hospitalization, patients often need rehab or transition to care. If those aren't covered, people face a cruel choice. Either pay hundreds of dollars out of pocket or go home too weak to recover. They'll fall, relapse in their health, and return to the hospital. It's a dangerous cycle we are enabling by cutting off the path to recovery. As a nurse, I want to provide care to every patient, the care that they need to heal. But if these cuts move forward, our most vulnerable will lose access to even basic care. And we as healthcare workers will be overwhelmed trying to manage crises that could have been prevented. We must listen to healthcare professionals. We must listen to our patients. Medicare and Medicaid are not wasteful. They are essential lifelines. They reflect who we are as a society. We either stand by our most vulnerable or we turn our backs on them when they need the most. Thank you.
Good morning. My name is Kate Lees, and I'm Assistant Commissioner for the Minnesota Department of Children and Youth Families. I'm here today to highlight the critical role of the Supplemental Nutrition Assistance Program, otherwise known as SNAP, and what's at stake for Minnesota families and our communities. SNAP helps more than 440,000 Minnesotans every month afford the nutritious food they need to live healthy lives. It supports families and our communities. SNAP does more than feed families. It strengthens communities. It keeps kids fed, helps seniors stay independent, and ensures our friends, families, co-workers, and neighbors can put food on their table. Nearly 70% of families with children receiving SNAP have at least one working adult, which means that even with a paycheck, many families still need help making ends meet. More than 3,600 businesses accept SNAP, making it a vital part of our local economy. Last year alone, $1.1 billion in SNAP benefits were spent across our state in grocery stores, farmers markets, and local food retailers, generating up to $1.50 in economic activity for every dollar spent. This supports our local grocery stores and their employees, our wholesalers, our transportation industries, and our farmers, to name a few. But we are facing a hard truth. Proposals to cut SNAP will send shockwaves to our state and make it harder for Minnesota families to put food on the table. Cuts to SNAP mean fewer dollars for families already struggling. Those cuts would disproportionately harm working parents and rural communities, tribal nations, and seniors on fixed incomes. And they would shift hundreds of millions of dollars in costs from the federal government onto Minnesota taxpayers. And as we know, food security is directly linked to chronic disease, developmental delays, and rising medical costs. When SNAP is cut, people get sick, kids fall behind in school, and our state's healthcare and education systems bear the cost. Adding Medicaid cuts to SNAP reductions doesn't just deepen the crisis, it pushes families to the brink of financial ruin, accelerates chronic health decline, and inflicts lasting harm on mental well-being. And when families break down, communities suffer through higher healthcare costs, lost productivity, and greater strain on public systems for generations to come. For young children in particular, access to healthy food makes a real difference. SNAP helps kids come to school ready to learn and to grow. Here in Minnesota's 4th Congressional District, 28,290 households rely on SNAP. Of those households, 50% include children, 39% include the elderly, and 45% include individuals with a disability. SNAP provides safety to our community's most vulnerable residents. With a record number of visits to local food shelves over the past couple of years, with over 9 million visits in 2024 alone, our emergency hunger network will not be able to absorb the increased needs felt by our community members if their SNAP benefits are reduced or eliminated. Thank you to Congresswoman McCollum for having us here today for this critical discussion of the impact of families, neighbors, and our communities. These critical programs help all of our communities navigate the uncertainty of life and to ensure that our loved ones and our neighbors are healthy and happy. Our programs serve more than 6,500 households each week. Our Today's Harvest markets are open 6 days a week, and they provide fresh produce and milk and meat and other items to the community members who lack access to affordable food. We also operate a drive-up program, a mobile food shelf, and a delivery program for those who lack transportation or have some sort of health barrier that prevents them from getting to our sites. We engage more than 1,000 volunteers a year to feed our community. We serve people like Jonathan. Jonathan has worked in IT for more than 25 years. He's a pro at solving problems and making complex things simple. But when Jonathan's company downsized, laying him and several other colleagues off, he suddenly found himself needing to apply for benefits and using a food shelf for the very first time. He relied on our Today's Harvest market for about 90% of his food until he qualified for SNAP benefits. And once he got enrolled in SNAP, he didn't need to visit us quite as frequently. He now just visits Today's Harvest market to fill the gaps while he works a warehouse job as he continues searching for another full-time IT job. SNAP benefits had a huge impact for Jonathan and his family, and he's one of 440,000 Minnesotans who rely on the program. That 440,000 total includes 152,000 children, 72,000 seniors, and 52,000 adults with disabilities. And they are at risk for the proposed cuts of $300 billion to SNAP. Our state can lose more than $200 billion in food benefits each year. That means less food on the table, more pressure on our state's already overwhelmed food shelves, and a negative impact on local grocers and farmers. The number of people visiting food shelves like Open Cupboard has risen dramatically over the last few years, and our system is strained. I told the story of Jonathan, but there are thousands of households who rely on just our food shelf every week. Families rely on us to provide the stability underneath them while they face other challenges. Seniors are able to eat the nutritious food they need to stay healthy, and children have the food that they need to focus in school. People like Beth and Barb, twin sisters who are in their 60s and live in St. Paul. They work part-time, but because of health challenges, they aren't able to work full-time. They rely on government programs like SNAP and our food shelf to put food on the table. Or Luther, who had a great job working in property management, and a wife and kids. But that income from his job quickly went away when he lost his sight, and he needed multiple surgeries. Luther and his family relied on our programs and SNAP to keep their family afloat while dealing with their crisis. These are real people that we serve, and real people who will be harmed by the cuts to SNAP. Food shelves like ours are already strained, and we're already working incredibly hard every day to meet our community's needs. But SNAP provides about 9 meals for every 1 meal that is provided by food shelves and food banks. Our emergency food system does not fill that kind of a gap. And at our food shelves, due to other federal changes, we're also seeing cuts to our food supply, our medical staffing, and our program. We're committed to rising to the challenge, just like we did during the pandemic and when our community needed us most. But these SNAP cuts would bring instability and potential health impacts to families like Jonathan's, like Beth and Barb, and for families like Luker's. People rely on us, our food shelf system, yes, but they rely on SNAP even more. So we urge our legislators not to support these devastating cuts to SNAP. Thank you very much, Congresswoman McCollum, for inviting me here to share our perspective. Thank you.
Thank you, Congresswoman McCollum, for the opportunity to share my story. I also wanted to thank all of you for being here today to show your support for such critical programs. My name is Sumuka Terkanambi. I'm 26 years old and I live in Lakeville, Minnesota. I work as a public policy consultant with the Minnesota Council on Disability and the Rare Disease Advisory Council. I also serve on the Governor's Council of Developmental Disabilities. When I was 4 years old, I was diagnosed with Duchenne muscular dystrophy, a progressive neuromuscular disease. As a result, I used a power wheelchair to get around and required assistance with acts of daily living. Before being on medical assistance, Minnesota's Medicaid program, my parents paid significant out-of-pocket costs for my care. Even though I had health insurance through my parents' employer, my parents still had to pay a copay for my medication and cover a portion of more expensive services, such as my power wheelchair. Additionally, items like a shower chair and a stair lift were not covered by my insurance and cost several $1,000s. Since 2020, whatever my primary insurance does not cover, Medicaid covers the rest. Through Medicaid, I also receive coverage for home and community-based services that are crucial to my independence and ability to live in my family home. It has paid for home modifications to make my home more accessible, a shower chair to assist with acts of daily living, and a ceiling lift to make it easier for transfers. Other services that are incredible lifelines include personal care assistance, transportation, and assistive technology. An example of my services and how they came together was when I was doing my master's in public policy at the University of Minnesota. Because of Medicaid, I was able to receive assistance on campus and get transportation to and from campus and to my internships. The support that was provided to me enabled me to complete my degree. Additionally, I know many people with disabilities who are also on Medicaid, who are gainfully employed and are leaders in their communities. They're living independently and living their life the way they want to. Overall, Medicaid has provided me and others with disabilities with the support we need to pursue higher education, volunteer, maintain employment, and be part of our communities. That's why I'm extremely worried about the $750 million in Medicaid cuts. These cuts would set the disability rights movement back decades, leading to the institutionalization of people with disabilities. That is completely unacceptable and immoral. The most frustrating aspect is that some lawmakers insist that people with disabilities will not be impacted by the cuts or work reporting requirements. But here are the facts. The cuts being proposed, like many have already stated, would consume state budgets, forcing states to make tough choices about what services to cover. Home and community-based services are optional under Medicaid and also happen to be more expensive services. Any cuts could put these services on the chopping block. This would be devastating to the well-being and freedom of people with disabilities. In terms of work reporting requirements, people with disabilities who access Medicaid through the expansion population and those who are waiting for a disability determination would need to report work activities to maintain coverage. Red tape and confusion would also cause many people with disabilities to lose their coverage. Finally, the state would face significant administrative costs, shifting funding away from patient care. Given the state, we must use our power to prevent these cuts from happening. So please continue to show up and make your voice heard. Keep contacting your members of Congress and urging them to protect Medicaid. Talk to your friends and family in other states and make sure they are contacting their elected officials as well. In this moment, if we put significant pressure on members of Congress, we will surely win this fight. So thank you all for taking the time to be here today. Let's work together to defend healthcare access for all.
Here's a couple of things I'd like you to keep in mind. We only have one microphone out there. We have a limited amount of time that we have the panel with us, so we can be in this room. There are other ways to reach our office. If you do not get your question asked, my communications director is going to put a QR code up here later, and Luke is correct. There's a QR code in your packet. So if you have a smartphone and you like to use that, I just got to visit the QR code. Wow, trust them. You can contact our office that way for the question or share your story. You can also do the traditional way with a phone. Still get messages every once in a while. You don't always and emails are a great way to reach us too. So if you don't get your question asked. So Charlie, who is it who has the microphone? Where are they? Okay. So Mary from our office, former, well, no, you're never a former Marine. Marine's in charge of this microphone, so we'll make sure everybody gets a chance here. So if you have a question, please raise your hand. We are going to try to move around. We know we probably won't. So as Mary gets out there, so you kind of highlighted some things, and I want to thank you all again for coming, because me getting up and just talking about numbers and statistics, you know, and the state legislators who are here, that's really important to them, because we have to share your stories. We have to make it real when we're on the household and we're voting on things to get those that one or two votes that I need to get that full Republican votes to make it all. So my question for you is, you know, you all have things that are on you, and I'm just going to bring out one thing that we probably won't talk about here, but maybe you're concerned about this too, is what happens with these Medicaid cuts to rural hospitals, rural providers, because as we heard from the nurses, we are already feeling staffing shortages and everything else. Just maybe, you know, doesn't have to be rural. What's the one thing that you're already having to plan for that really has stressed you and the staff out, maybe the families at Gillette?
So without, you know, it's always hard to know what's going to happen without freaking out your staff and your community. in the meantime. So what with Gillette and with other pediatric systems, all hospitals are doing, we go through and do cost management just like we all do at home. We make difficult choices, but where we are headed between the escalating costs in the supply chain and the pharmaceutical supply chain comes to that impact insurance decisions to cover and cover. We have to care manage in a way families understand, which we do not. This is what the next year looks like. This is what the next year looks like. And trying to plan when you don't know if the safety net program is there is tough. So a lot of times in Washington, not the state representative with the local, we're told just go out and fundraise. That's what hospitals are told. Give philanthropists, do some fundraising, stop doing some things. But when you're treating the body, what part do you stop treating? And there's not enough money as generous as Minnesota, the US is, to cover the cost of medicine care. So we're making choices of where do we have to slow down, where do we speed up, how can we leverage the other systems that you've heard about, how can we better leverage school nurses? We all know what's happening there, and now the education cuts. How do we leverage our county services? Those are being cut. So all those safety concerns. So the way of saying is we're preparing for the worst, which I don't want to, but we're all trying to say, how do we keep the doors open, have qualified staff like those represented today, make sure that our staff are cared for, well, they're protected from violence and all these things that you hear, and make sure that we can be there when people need us. And the reality is, I wish I had more hands. So the way that, let's give a round of applause to the school. Theater, and so these lights are set for me to look straight out and for there to be darkness out here. And so you all have halo. So, which is my favorite thing really well. So
Thank you, Representative McCollum. In addition to the Medicare cuts and the Medicaid cuts, one of the things I'm really concerned about as a senior is, the lies that we're told concerning no taxes on Social Security, no taxes on overtime, no taxes on tips. President Trump recently talked about Pinocchio. A $4,000 tax deduction is not tax-free Social Security. Gives you a little lump, but it's a lie. No taxes on your overtime, but when you still pay tax on the base wage, it's a lie. No taxes on tips, when the government picks and chooses what tip employees pay taxes and don't, it's a lie. We need to get that message out. Whether you're a Democrat, an independent, or Republican, we know about it, or we can argue about that. You can't argue when somebody lies to you and says they're going to give you money. That message has to be heard loud and clear across the political spectrum. What we need to get that message out.
well, I think if you could put the debt chart up again. So everything's a balance sheet. I mean, you do that every day in your lives, right? You have to balance your budget. Well, I had a daughter who worked in utilities that she's going to college. Love not to be taxed on her. For those of you with Social Security, it'd be great not to be taxed on Social Security. But something else that has to kind of balance it. So I guess we can't get that slide back up. It's just show that. There it is. I turned around and I saw that darn QR code. It scared me. So you can see what happened in the 17 tax cuts. Those did not pay for themselves. The added to that. And then what's in some of those provisions that you were talking about, sir, are starting to be accounted for. That President Trump says we're not. Nobody's going to pay taxes. It's in the
trillion. So you put that together, it's only going to get worse. So very concerned about that, and it needs to be honest. It sounds good. Who likes to pay taxes? I don't. Who wants to see all their services cut? I don't. And it's balancing, and that's what we have to do. So we have somebody on this side for a question?
Okay. This is a very diverse situation here today. People will definitely die when this bill is passed. Those solutions have been really popular so far in this town hall. Representative McCollum, you may not be able to do anything until after the midterms if you are up for re-election. But now, you have considerable clout to whip the state legislators to pass a tax the rich corporations bill.
Doing their lane of traffic, and just as I said, I don't cross the track. They all hurt you, and that's not my lane of traffic. I used to vote over there. They hurt you out in Clare. And, I'm not trying to be flippant about it, but they're trying to balance their budget, trying to figure out what's going on. And as I said earlier, they have no idea what the federal government's going to do to their bottom line. I think they're going to be in a special session through no fault of their own. And that's because of the Republican reconciliation bill and the fact that the Republicans have given them money that they were promised in the 2025 bill of budget. So it's really a slippery road back there. Next question. Trying to get around to get different places.
One of the things you didn't mention, Betty, was all the increases in spending in this bill, especially what concerns me is $150 million for mass deportation.
Thank you for raising that. There's also the president's parade on his birthday I didn't mention. And I've been asking, we've got limited time, so I'm not happy about it. Let's kind of keep the wind down. So there are all kinds of things in the bill that are absolutely great. And I know Governor Wallace is coming to my understanding. Governor Pritzker and Governor Moore, and our understanding is that they're going to be ripped up and down for not doing enough for you to have your state dollars being used to deport people without due process. And I think our governors are going to stand firm and saying that the rule of law needs to be respected. But there's money there for detention beds, flights, military equipment being moved around. Know that we've been asking for information, just as the courts have been asking for information on the deportation. And every single time the Department of Justice, Homeland Security, or ICE doesn't answer a question, they don't end it. Timely, effectively, and truthfully, the judges are taking note, even Republican appointed judges. And I think it's going to go really bad for them at some point in front of the Supreme Court with what they're doing with illegal deportations. Now, if somebody breaks the law here and they're here illegally, they need to be held accountable and they need to be tried. But they need to be tried and not just have American citizens, Native Americans, in fact, in Arizona. They won't recognize, ICE picks them up, they won't recognize the tribal ID. They deported citizens, and that has to stop. So the power of the purse is one thing we'll try to do. We'll try to cut back the use of money, to cut back on the abuse that ICE, the abuse that the Customs and Border Patrol are doing right now, which is rounding people up, trying to make it to President Trump's goal of 1 million people. Innocent people are getting caught in that, and our taxpayer dollars can't be used for that. But I'm working on the parade right now, trying to get an answer back. I'm going to go back to Monday and ask them, where's the budget for the parade? Can we have, is there a question from one of the panel?
members here. This is not specifically for the panel, but my name is Pam. I'm here in the area. If some people are interested in new local effort that is small but very energetic to try to help protect Medicaid. I am a leader of that group and I'm 25. I have a brother who was born with brain damage at birth. He, for 25 years, worked 40 hours a week. However, we learned that as he aged, his capacity would decline. So if you are interested in hearing more about that local effort, it is very easy to become part of it. We don't expect you to stand on street corners, etc. I will stand outside the door, and you are welcome to come and see me. And thank you again to all of you for all your efforts and incredible work you do.
Hi, Representative. I'm Teresa. I live in Mount Groveland. Thank you for your service. Thank you for the work that all of you on the dais up there do every day. I think it's safe to say everyone in this room is on your side, and we agree that the cuts are absolutely destructive. So you don't need to convince us. I'm asking, what more can we do to stop the cuts? I have written letters, I've gone to protests, I have shown up at millions of events. I don't feel that anything's happening. So I want to know, is there something we all can be doing to prevent this? And Representative McCollum, is there something that you're planning to do? And I'm going to ask you to maybe step out of your comfort zone. I'm done with when they go low, we go high. We have to start doing things that are different than we've done in the past. I'd love to see you every day with some of your colleagues coming up, telling the stories of the people that they've heard, bringing those people forward. We all are on your side. We get that. But the people who are watching Fox News aren't. COVID, everybody watch the governor every day in our state and many other states. Come to the things to watch every day. I'd love to see that. I'd love to see you say, I want Doge in here. I want to stop them in all these agencies. I want the money released. So I'd love to see you doing something out of this. I'm going to ask a question.
You reached out to the press, that's correct? How many responses is there anyone from the press here? There's no one from the press here. My point is, I'm not whining. I'm still doing this. That's why we're recording it. We're putting it out there. We're doing 1 minute on the floor. And also representatives sharing the stories. That's why I asked you to share your stories. I talk to these folks all the time. I'm speaking with the legislators all the time. You know, I still have committee work and things that I am doing. And I have responsibilities. The EPA was cut 65%. And I'm working on that as well as some of the illegal things that you're seeing. So we're out there. The House Democratic Caucus has been traveling around, having different hearings in different areas. We had 400 people sign up for this. I know a lot of them are probably at home with other people going to watch it later. I can't do this alone. The fact that you're here, the fact that this panel gave out part of their Saturday to come out here to empower you with more information. I heard this. The governor, you know, I read the governor's letter. Our state legislators are here because they're concerned about what's going to happen to our communities and our families here. Sharing the story, working with the woman who got up and said that, you know, she's putting a group together. Don't underestimate for 1 second that you're not making a difference. That bill passed by 1 vote and 2 people, as far as I'm concerned, took a hike. Because they were feeling the pressure. And the pressure was coming from all of you. And when you you share your stories, and I write these letters that I don't get answers back to, they go in a folder that goes to the district courts, the Supreme Courts, their amicus briefs. And I'm saying this is unconstitutional or illegal, and I'm doing it with Jake Raskin and folks on the Judiciary Committee. And the courts, when they're making their ruling, they are referring to our amicus briefs,
which are well thought out and sometimes has information from panels that are here that work with my office all the time and expressing your outrage, your disappointment, and the fact that you want your government to reflect your thoughts, your opinions, and not for votes to be taken in the dead of night or as the sun's coming up. Thank you for your passion. We have time for maybe 3 more, and there's more than 3 hands up. But we do have one other side where I can kind of see with big halo has got her hand up all the time. So 1, 2, and then somebody's going to be mad at you and not me. So
My name is Sunny, and I would like to invite everybody here to actually do something on the Oak Park Crossings Bridge. Every other Saturday from noon to 2, we are protesting these cuts. June 14th, we're going to have a big rally there. And this is something that you can actually go out and do today, right after this, if you want to.
Is your arm sore? Is it tired?
I'm a special ed teacher, I'm good. I just retired from special education. I'm a volunteer at Gillette in Child Life. I see everything that does for kiddos. What a lot of people don't realize is how much the schools depend on Medicaid. And that is something that I don't think anybody realizes. If we have a student who has activities of daily living, maybe help with toileting, feeding, getting clothing on and off, transferring, they have nursing services, sight, speech, OT, PT. Because IDEA is not paying their 40% that they promised, when they're paying about 15%, the schools, if we have students that are eligible for those, we bill Medicaid. And that's what helps fill that gap. If we lose Medicaid and our lovely friends in Washington decide to not fully fund IDEA, our students are either going to not get the services they need, not get the attention they need. We're going to be having to give kids the environments. We're going to look at the big groups. My question is, how much do people really know about this? I mean, it doesn't seem like other outside of the government, small government world. And how much are you going to be able to push for full funding of IDEA in this bill?
I'm going to let our panelists from disability community answer this really quick. But to your point, when they first started talking about cutting Title I, I did something I had never done before. I scared my staff. I said, we're taking something right now. I don't want anything scripted. I'm not going backwards. So very, very, very involved in it. But could you maybe fill us in on some of the things that you're concerned about right now? How the state and how the federal government, with our lack of action, the impacts it's going to make on people with challenges in their life from that are diagnosed sometimes in the hospital, all the way through. You have some great examples.
Yeah, I can definitely speak to that. I mean, like everyone has said kind of already, that Medicaid definitely plays a huge role for people with disabilities. Like I mentioned, home and community-based services are only covered through Medicaid and no other private or even public insurance. So it's really the lifeline. I know there's threats, like the disability community is getting a lot of threats from all sorts of areas, including education, like you mentioned. I know special education has become a concern, especially with some of the things that are happening at the Department of Education. And then just even disability programs are on the chopping block for the president's budget and things like that. So there's really a lot of threats that are happening. I know specifically for the IDEA funding, I know there is a bill that is going through Congress right now that is supposed to make sure that the federal government is paying, I think 40% or something for So that's, I'm not super familiar with the issue, but I know that there is legislation that I believe there's bipartisan support that's currently going through Congress related to that. But I do think the cuts are definitely a huge concern, and that's why everyone's here today. So hope I answered that question.
So these folks are here as a resource for you, and we can make sure that you have information, you have descriptions of the jobs that they do. You're a city commissioner, and we've got children and families, and we all know how to get a hold of this. We have an entire special education person. We can all look into our group shelves, can we not? I think this is our third and last question.
Good afternoon, Representative McCollum. I guess I just wanted to ask a question, but also provide you some advice. So the advice that I have for you, you're not alone. If you need help, I'm going to say, I know plenty of good people that have that are your colleagues that you can go to. Senator Bernie Sanders are good examples. They've been going out. They've been talking to people in regions. They've been actually going to red states to talk to those people that are maybe over there who only listen to Fox News and don't get their information. Cory Booker, your senator, or the senator who I think he broke a record.
Yep, they're out there, they're doing it, we're out there doing it, and I'm here. So your question?
My question to you is, what exactly are the Democrats planning in the future to fight back against Republicans? Other than just going to the courts and having the judiciary fight back?
You know, one thing I did, and I had some criticism for this. I went to the State of the Union. I had people, I had Democrats furious with me. I said, you know, I'm going to the State of the Union, because if I'm not sitting in that chair and other Democrats not sitting in that chair, they feel that chair is sitting in that chair. Not giving my seat to somebody who's going to stand up and cheer. So there are subtle things that we're doing, and sometimes people don't even realize that we're trying to kind of get in your face a little bit about it. I've got appropriation hearings coming up for the next couple months, and we're going to, and so I'm one of the people who helps pass the bills that are supposed to be passed that become law, that President Biden signed into law for 2025 that these state legislators are not seeing the money for, and we're going to be as much as we can. Shaking him if it deserves to be shaken, asking questions, or asking my colleagues, so we're only 4 votes away to make a difference on bringing some of these things up, why aren't they doing it? So we will have a national platform to do that in the Appropriations Committee. And that's my job, is to be there at those meetings in the chair, pushing, really, if you, I say this is a social studies teacher with all sincerity. If you really want to be engaged and watch a lot of C-SPAN, we usually put out, especially on the committees that I'm up doing it, we are out there, we're doing it. Part of it's getting coverage. And that's why I pointed out, we let everybody know about this, and nobody chose to show up and cover it. So that leaves it up to us to cover. So I'm here on my official side, I have an unofficial side where I do things. And we are out there. If you're not, this is a great way, I'm gonna close up. If you are not, how many, I'm not gonna do it to you. I bet a lot of you aren't signed up for my newsletter. Hang on. You didn't have to necessarily be here with someone. The press actually did cover the fact that it's happening. If you're not signed up for the newsletter, you're missing a fabulous way of knowing what I have been up to and what I've been doing. We're on Blue Sky. We're still on X. We're still, because that's where the majority of people are. The Democrats are still on X. Let's change that. Instagram and other things. But don't wait for the Pioneer Press, the Star Tribune, or any of the local news stations to cover anything that I've done or centered any of my speeches on the House floor. So amplifying our shared message, because this is our message, and that's where I need your help, reaching out to other people. We are out there doing things, and ALC is just we're friends. She's a fantastic member of Congress. If AOC was here in my district, she put me to shame. I know that. That's okay. We still work together on a lot of things. Senator Sanders and I do. But part of it is the press tends to follow a couple of people so you see them more in their profile. And that's okay. We need people that the press want to cover. And those of us who are not going to be the big dogs for the press to cover on the story, I have a job to do. And I'm going to do it whether or not the spotlight is on me. So we got the QR code up here. The QR code's in your packet. We have a constituent guide in the packet. If you do not get the newsletter, I cannot sign you up for a newsletter, even when you sign in, you have to affirmatively ask for it. You don't know if that's a state legislator. Minnesota's an opt-in state, and I respect that. Some of this Congress is already opt-in. I don't. I voted for that law, important law. If you want to get our newsletter, if you want to get our updates, you have to opt in to do that. Thank you all for coming. There's another group of people I want to thank here at the end. This was a respectful, wonderful conversation. Let's thank our panelists again here for being here. And there's another group of people who I am glad came and didn't have to do anything. I want to thank the Stillwater Police Department. They are amazing. They are amazing. All the local police departments are absolutely amazing. And when I saw the blue cars when we pulled out, I thought, oh, we don't need this. And then I remember what happened if you have to get this. The close friends with staff person with the longest. So I don't take your safety for granted. So I want to thank the Stillwater Police Department for not taking our collective safety for granted. Thank you so much. So sign up for the newsletter, get involved, be involved, write a fully accountable. When the press does call me and I can tell them how many letters and emails I got, that's great. And then I can also do how many did you get? Thank you.